If you've ever dealt with knee pain from a meniscus tear, whether it was caused by a sports injury or everyday wear and tear, you know how debilitating a meniscus injury can be. And in this video, I want to talk about a potentially exciting treatment that's on its way, maybe already here for meniscus tears, and those are exosome injections. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. As always, this video does not contain specific medical advice. It's meant for general information and educational purposes only. Specifically, when we're talking about regenerative orthopedic surgery and regenerative treatments, these are considered experimental by the FDA. Definitely, exosome injections are. And so I am not promoting them. I'm not promoting my practice. I am not telling you should do exosome injections. I just want to put information out there in hopefully easy to understand language so you can understand it and make the best decision for you. First of all, and I've done so many videos on meniscus tears, but real quickly, the meniscus is a C-shaped piece of cartilage in your knee. There's one on the inside, one on the outside of each knee. It's a shock absorber between your femur and your tibia, your thigh bone and your shin bone. You can get a tear from a specific traumatic event, a twisting motion, maybe in a sport, or it can be degenerative changes as we get older. Meniscus tears cause pain, they cause swelling, they can cause stiffness, they can even cause the joint to lock or at least cause a locking sensation within the knee. We can try things like rest, physical therapy, anti-inflammatory medications. Most of the time that doesn't get the meniscus tear to heal, so typically we talk about surgery, and that's either trimming the torn part of the meniscus out or to sew it back together to repair it. I have done thousands of those surgeries, so I am intimately aware with meniscus tears. The problem is, and what I'm well aware of, surgery isn't always ideal. A lot of the tears are in an area where they won't heal. There's limited blood flow to that area, the so-called white zone of the meniscus, so they don't heal on their own. That's why a huge percentage, vast majority of those surgeries are trimming out part of the meniscus. That's in theory where exosome injections might be helpful. Exosomes are microscopic vesicles, sort of envelopes or bubbles released from one cell that act on another cell and usually released from stem cells. They carry a lot of bioactive material, proteins, growth factors, lipids to promote healing of the other cells without actual cells in the treatment. Now you're injected just concentrated exosomes directly into the knee without the stem cells. They work by reducing inflammation. They stimulate the body's own cells to proliferate, migrate to the site of the injury, the site of the meniscus, and hopefully to promote tissue regeneration. That could be healing in hard to heal areas or improved rates of repair and healing of a meniscal repair, which would be very important because anytime you can preserve the meniscus, preserve that shock absorber rather than having to trim it out, that's always good for the health of your knee long term. Now, as I've said in numerous videos about exosomes, the research is very promising, but it's early. We have a long way to go. Most of the studies looking at exosomes are animal models, and they've been shown to enhance meniscus healing. There are meniscus studies with animals, enhanced meniscus healing by activating signaling pathways, boosting cell growth, cell migration, and that is very promising when it comes to getting these areas, especially the avascular part of the meniscus, to heal. In degenerative meniscus tears, as we get 40 and older, they tear without a specific event. The hope is that by injecting them into the joint, it'll decrease pain and improve tissue repair. Studies have shown less pain, improved mobility, and faster recovery methods, potentially even avoiding surgery. But we need more human data, long-term data, and especially comparing them to other treatments, controls, placebos, but also the things that we do naturally, steroids in the case of degenerative meniscus tears, and even surgery. So this is by no means, at least as of yet, a miracle cure. There's a long way to go in the research. It's also not FDA approved. Insurance doesn't pay for it, so you're paying out of pocket. So there's a long way to go. But as far as treatments go, looks like minimally invasive, minimal side effects, occasionally some injection site discomfort or swelling, but really no main long-term side effects that we definitely or that you definitely worry about. Important to if you're going to do it, again, it's experimental, but somebody very familiar with this, somebody intimately familiar with meniscus tears or whatever the different injury is, but to thoroughly consider all your options and decide if a regenerative treatment is necessarily right for you, but potentially helping to avoid surgery or to preserve tissue that's natural in your body to slow the progression of degeneration of your knee. Certainly something that is at least worth thinking about. Just know some of those disclaimers I was trying to get across. Okay, I've written an entire ebook. It's called The Arthritis Solution, but it really applies to all different types of orthopedic injuries, not just arthritis, and talks about a wide range of treatments, all the way from supplements up to things like exosomes and anything and all in between. You can get that completely free. There's a link to it in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots from somebody that's an orthopedic surgeon that doesn't just offer traditional treatments, you can click the link in the description below that takes you to my website, fill out the contact form. You can potentially schedule an appointment to see me. Also, I'd love to hear about your injury, meniscus tear or otherwise. Leave those in the comments below this video. Just understand, if you leave a question there, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thank you so much for watching. I hope this was helpful, and I look forward to helping you feel, look, and perform better than ever.